Hello, I'm Dr. Resul Yaman. Now we will share before and after photos and videos of a patient whose operation we performed 7 years ago. When we look at the before and after photos, it's quite possible to notice the passing years from the patient's skin texture in the pictures. However, even after 7 years, our patient still looks younger than before because the structure of his hair, his new hair, is what makes him look young. When we look at the photos taken from above, with his head slightly tilted, we can see how well the patient's hairline actually suits his facial features. If we had created a straighter hairline for this patient, it would have looked very unnatural when he reached his 40s. Right now it looks very natural. The direction in which the hair grows is also very important. He has a hair growth direction that matches what is natural. When we move on to the videos, you can see this in great detail in the video as well. In fact, the hair still retains its strength and resilience. I want to mention a very important detail here. We often hear about stem cell treatments. They are used in every field. They are also used in hair transplantation. So what is the process referred to as stem cell treatment in hair transplantation? The process being done is the same as what we do. A piece of tissue is taken from here. It is centrifuged and injected into the balding area. And the aim is to sustain the stem cell activity there. A doctor who knows the structure of the hair follicle and the root in hair transplants knows this very well. As you can see in the diagram on the side, there are actually in the stem cells around each hair follicle. If, when extracting the hair root, you do so together with the stem cells, knowing the thickness of the hair, leaving enough surrounding tissue, using a sharp punch at the correct speed, and then keep the extracted hair in a good solution in a cold environment, you actually preserve the entire structure of the hair, both its stem cell activity, its root cell activity, and its root. Therefore, you are transplanting hairs that are much stronger and can last for a much longer lifetime. You will see the benefit of having a physician who understands tissue, who knows cells, who knows cell biology, and who knows how cells will behave involved in your operation, not only 6 months later when your hair grows out, but also 6 years later, and even for a lifetime.